right, get ready for a deep dive, you guys. Today we are exploring the fascinating world of Hildegard Peplau and her groundbreaking interpersonal theory in psychiatric nursing.
Sounds exciting.
You bet, and lucky for us, you've sent over some really interesting excerpts from Peplau's works for us to dig into. We're going to uncover the core principles of her theory and discover how you can apply them in various clinical settings.
Perfect.
So before we jump into the theory itself, could you give us a little background on Peplau? Who was she, and what makes her work so important?
Well, Hildegard Peplau is a true pioneer in psychiatric nursing. I mean, just imagine she started her career as a nurse way back in 1931.
Wow, that's almost a century ago.
Yeah, and she didn't stop there. She went on to earn degrees in both psychology and nursing, eventually even becoming a certified psychoanalyst.
Really impressive.
Oh, and get this, she also established the very first graduate program specifically for psychiatric nursing specialists.
Talk about a trailblazer. So she clearly wasn't afraid to challenge the status quo. I noticed that in her writings, she really pushes back against those traditional mechanistic views of mental illness. It's like back then, the focus was all about fixing the broken machine, right?
Right, exactly. It was all about the illness itself.
But Peplau introduced this whole new dynamic perspective, didn't she?
She did. She really emphasized the importance of the relationship between the nurse and the patient, this constant back and forth,
That interplay?
Yeah, the interplay that shapes the entire therapeutic process.
So it becomes less about just treating the symptoms and more about understanding the person behind the illness.
That's it. It's about truly connecting with the patient's world, their unique perspective. You see, Peplau believed that to help someone, you have to really get in touch with their reality. See the situation through their eyes, so to speak.
That reminds me of a story she tells about a patient who constantly felt like they were slipping off the bed.
Oh, yes.
Not literally, of course, but more emotionally.
Right, emotionally deteriorating.
What I find so fascinating about that story is how the nurse actually used Peplau's approach to understand the patient's experience. So this patient was experiencing hallucinations, and instead of dismissing them, the nurse viewed those hallucinations as expressions of the patient's inner struggles.
Exactly. It was about digging deeper and understanding the meaning behind those experiences.
Uncovering the why, right?
Yes, the why. And the nurse helped the patient to decode the meaning behind their hallucinations, which ultimately led to a breakthrough in their treatment.
That's amazing. And speaking of breakthroughs, Peplau also had this interesting idea about favorable change. I think we often think of favorable change as the patient simply conforming or getting better in a conventional sense.
Right, like fitting back into a predefined mold.
But Peplau, she kind of flips the script. She really emphasizes the idea of growth and learning that happens during illness. Like patients can develop new skills and coping mechanisms that they can use even after recovery.
Absolutely. It's about becoming stronger through adversity.
Almost like the illness becomes an opportunity for self-discovery and growth.
In a way, yes. And here's where the nurse plays a critical role. Peplau often talked about the nurse's ability to help patients stretch their capabilities. It's about empowerment, not just fixing the problem.
I love that. That's a very empowering perspective. And to help nurses understand human behavior within a developmental framework, Peplau developed this interesting tool called the Tools and Tasks Outline, right?
You got it. It's like a roadmap that helps nurses understand the tools people use at different stages of life.
So what are some examples of these tools and tasks?
Well, imagine a child in the anal stage of development. Think about the tools they use. They might use withholding, like refusing to use the potty, as a way to exert control over their environment.
And that makes sense, right? At that stage, they're learning to assert their independence.
Exactly. And as children grow, their tools and tasks change too, like pre-adolescence. They start relying more on what Peplau called consensual validation.
Consensual validation.
Yeah, basically talking things out and comparing perspectives to reach a shared understanding. It's all about communication and social interaction, crucial tools for that age.
Because that's how they make sense of the world around them?
Precisely, and all of this underscores the critical role of observation in Peplau's theory. She really believed that nurses need to be keen observers. They need to have a sharp eye and a solid understanding of human behavior to fully understand their patients.
So it's like being a detective, piecing together clues to understand what's really going on.
Yes, very much so. And Peplau gives this great example of a pediatric nurse who misunderstood a child's behavior simply because she had her own preconceptions.
What happened?
Well, she saw the child acting out, and instead of trying to understand why, she just labeled him as disobedient.
Oh, that's tough.
But if she had a deeper understanding of the child's anxieties, frustrations, maybe even underlying aggression.
Yeah, she might have seen the behavior as a cry for help.
Exactly. A way of communicating an unmet need. That kind of understanding would have led to a much more effective and compassionate intervention.
Absolutely. That's so important. It seems that this emphasis on understanding is woven throughout Peplau's 4 key points for professional nursing.
Oh, definitely. Those 4 points are like a guiding compass for any nurse.
So what are they? Can you walk us through them?
Sure thing. So the first point is that Peplau believed every interaction with a patient is a learning opportunity, both for the nurse and for the patient.
It's a two-way street.
It is. Then, secondly, she highlighted the need for a solid theoretical framework. It's not just about intuition or gut feeling. Nurses need to have evidence-based knowledge to address their patients' psychological needs.
It's about having the tools to interpret what they observe.
Exactly. And the third point, well, she stressed the importance of continually refining our understanding of the patient's world. We should always be observing, analyzing, deepening our understanding.
And what's the fourth and final point?
The fourth, and perhaps most crucial point, is the need to create a safe and open environment for patients to discuss and make sense of their experiences.
It's all about building that trust.
It is. That's where the therapeutic relationship truly blossoms.
I can see that. Now, Peplau also talks about interpersonal constructs. What are those exactly?
Think of them as lenses through which we view our interactions with others.
Okay, interesting.
Peplau breaks these down into content, form, and integration. Content is the topic being communicated, form is the style or approach used, and integration looks at how these pieces fit together to form a pattern in the interaction.
So it's about looking beyond the words themselves.
Absolutely. You're trying to understand the nuances, the unspoken messages, the dynamics between people, and that's where nonverbal communication becomes so important.
Right, because sometimes what's not said speaks volumes.
Exactly. And Peplau highlights this idea of empathic linkages. Basically, our ability to tune into others' feelings, even when they don't explicitly say how they're feeling.
It's like reading between the lines, sensing the emotions behind the words.
Exactly. Now, this brings us to another fascinating concept, double-bind communication. It's where the verbal message contradicts the nonverbal message.
Oh, I've definitely experienced that. It's like when someone says they're fine, but their body language is screaming anxiety.
A perfect example. Those mixed signals can be so confusing for anyone, especially for a patient who's already feeling vulnerable.
Makes sense. Clarity and consistency in communication are essential. Now, I know Peplau also discussed these ideas of patterns and variations in patient behavior. Can you elaborate on that a bit?
Sure. Think about it. We all have recurring patterns in our behavior, right? Themes that kind of repeat in different ways. Peplau observed this in her patients and believed it was a valuable tool for understanding their needs.
Can you give us an example of how this might show up in a clinical setting?
Let's say you have the patient who has a history of being a talebearer, someone who often shares information about others, maybe to authority figures.
Oh, like the classic gossip.
Not necessarily with bad intentions, but someone who habitually shares details about other people.
Okay, I see.
Well, Peplau noticed that these patterns often carried over into the ward setting. So the patient might start informing staff about other patients' activities or behaviors.
So those familiar patterns reemerge even in a new environment.
They can, yeah. And it's the nurse's job to recognize these patterns, not to judge them, but to understand how they might impact the patient's relationships and overall well-being.
That's fascinating. It emphasizes the importance of understanding a patient's history. It can really inform how we approach their care in the present.
Absolutely. It's all about seeing the bigger picture, understanding the whole individual, and that connects directly to Peplau's ideas about the therapeutic milieu.
Right? She believed that the environment itself could be a powerful tool for healing.
She did. She saw the ward as a dynamic space for interaction and therapy, not just a place to house patients. This was a radical shift from the old custodial model of care.
Back when it was all about containment and control, right?
Right. Peplau helped move the focus toward creating an environment that genuinely promotes healing and growth.
And that idea has been hugely influential in shaping modern psychiatric care, hasn't it?
Without a doubt, her work on the therapeutic milieu is constantly evolving and being refined even today. It's a real testament to the power of her ideas.
Speaking of powerful ideas, one that really struck me in Peplau's work is her focus on preventing chronicity.
Interesting. What do you mean?
Well, it seems like she was concerned about practices that might unintentionally maintain illness instead of promoting recovery.
You know, you're absolutely right. She was especially wary of those power struggles that can develop between staff and patients.
Could you give us an example?
Well, picture this. A patient refuses to take their medication.
Okay.
Now, instead of taking the time to understand why they're refusing, maybe they're afraid or they don't trust the medication.
Or they just don't have enough information.
Right. But instead of understanding, the staff might resort to coercion or force. You see the problem.
It creates a power struggle.
Exactly, and that can make things worse. The patient's resistance grows, trust erodes, and their illness might actually become more entrenched.
It really emphasizes the importance of understanding and collaborating with the patient rather than working against them.
Peplau also found the concept of testing within the therapeutic relationship fascinating. She noticed that patients would often test boundaries, see how the nurse would respond.
Oh, interesting. It's like they're saying, can I trust you? Will you still be there for me even if I'm difficult?
You hit the nail on the head. And how a nurse responds to those tests can be really crucial. It can either build trust or damage the relationship. It's all about being consistent, demonstrating support.
Not avoiding conflict, but navigating it skillfully.
Exactly. Now, another thing that really struck me as groundbreaking about Peplau's work was her view of the nurse as a psychotherapist.
I don't think that was a common perspective back then, was it?
Not at all. It was a revolutionary idea. She challenged that traditional doctor-nurse hierarchy.
So not just assisting the doctor, but taking a more active role in the patient's mental health care.
Exactly. She believed that nurses, with the right training and experience, could be very skilled in providing psychotherapeutic interventions.
So not every nurse is a psychotherapist, but there's a pathway for those who want to specialize in that area.
Right, and Peplau really dove into some complex topics. One that I found particularly impactful was her work on loneliness. She considered it such a profound human experience, didn't she?
She did, and what's interesting is that she traced it back to childhood. Those early experiences of feeling unheard, misunderstood.
It's as if those early wounds can create this deep-seated sense of isolation that can linger even into adulthood.
Wow, that's powerful.
It is, and she outlined these common behaviors that lonely individuals often exhibit. Things like craving proximity to others, even if they struggle to connect.
It's that push and pull, that desire for closeness, but also that fear of rejection.
Exactly. She also observed that lonely individuals might idolize others, putting them on a pedestal.
Trying to fill that void.
It can be that. Then there's role reversal, where the lonely individual might become the caregiver even when they need care themselves.
It's like they're trying to earn love through their actions.
And finally, she noted that lonely individuals often have difficulty making plans. It's as if they're stuck waiting, unable to fully engage with life.
Almost like they've lost that sense of agency, that belief in their ability to shape their own destiny.
You got it. And that feeling of powerlessness just exacerbates their loneliness. It's a vicious cycle.
Peplau's insights are so valuable. They make me reflect on how many of our patients might be silently struggling with these very same patterns.
It's definitely something to think about.
It really highlights the need for us as nurses to be more attuned to these subtle signs and offer support. But we've covered so much already. I think it's time for a quick break.
Sounds good to me.
When we return, we'll delve into Peplau's work on anxiety.
Looking forward to it.
Me too. It's such a prevalent issue in mental health, and I can't wait to hear her take on it. So let's dive into Peplau's perspective on anxiety.
All right, sounds good. Are you ready for this?
Absolutely. It's such a common issue for so many patients. I'm curious to know what Peplau had to say.
Well, what's really interesting is that Peplau didn't view anxiety entirely negative. She saw it as a natural human response to stress, something we all experience. And in milder forms, it can actually be beneficial.
Beneficial. Really? How so?
Think about it, that feeling of alertness, that little edge you get when you're facing a challenge, it helps you focus, maybe even perform better, like those butterflies you get before giving a big presentation.
Okay, yeah, I could see that. A little bit of nervous energy can be motivating, but when does it become a problem?
Well, when it goes beyond that, when it starts getting more intense, Peplau actually outlined 4 levels of anxiety: mild, moderate, severe, and panic.
Oh, interesting. So as anxiety increases, it starts to impact our ability to function.
Exactly. It affects our thinking, our perception, everything. Want to walk through those levels?
Yes, definitely. Well, what are the key differences?
Okay, so mild anxiety, we already touched on that sense of alertness, increased focus. But then as it ramps up to moderate anxiety, well, your perceptual field narrows, you become less flexible in your thinking, problem solving gets harder.
It's like getting tunnel vision. You can only focus on the threat.
Precisely. And you start seeing those physical symptoms too, increased heart rate, sweating, tense muscles.
And then what about severe anxiety? How does that manifest?
Things get even more intense with severe anxiety. You might get headaches, dizziness, chest pain. Your thoughts get all scattered, and concentrating on anything becomes almost impossible.
It sounds really overwhelming.
It can be, definitely. And then there's panic. That's the most extreme level.
Panic attacks. I've heard those can be terrifying.
They can be. It's a feeling of absolute terror, like you're in imminent danger. You might feel like you're losing control completely.
Wow. What kind of symptoms might someone experience during a panic attack?
Lots of things, actually. You might see a racing heart, trouble breathing, feeling like you're choking, or even feeling detached from your surroundings, almost like things aren't real.
It sounds really scary.
It is. And for nurses, recognizing these different levels of anxiety and how they present is so important.
It's about understanding those nuances so we can provide the right care.
Absolutely. Now, shifting gears a bit, Peplau also had some interesting thoughts about the self system, how we see ourselves.
Oh, yes. And wasn't that central to her understanding of mental health?
It was. She saw the self system as the core of our personality, the way we interact with the world, and she believed that this sense of self develops through our interactions with others.
Especially in early childhood.
Right. Those early relationships, especially with our parents or primary caregivers, are really influential. Peplau talked about those interactions shaping what she called the good me and the bad me.
Good me and bad me. Can you explain those a bit more?
Sure, imagine a baby. The baby cries, and the caregiver responds with warmth and love. That reinforces a sense of good me, a feeling of being worthy and loved.
So positive interactions build that foundation of self-worth.
Exactly. But what if those needs aren't met? If a child experiences neglect, rejection,
That must contribute to the bad me.
it does. The child might start to see themselves as unlovable or incapable. And these good me and bad me perceptions, they really become the building blocks of our self-system.
It's almost like those early experiences can leave a lasting impact on how we view ourselves.
It's true. They can influence how we relate to others, how we handle challenges, everything.
But it's not fixed, is it? Our self-system can change.
Absolutely. That's the good news. As we have new experiences, form new relationships, reflect on our lives, we can change how we see ourselves.
That's really empowering. Now, Peplau also did some groundbreaking work on hallucinations. I think for a lot of people, that's a difficult concept to grasp.
It can be. And Peplau had this unique perspective. Instead of just viewing hallucinations as something to be eliminated, she saw them as a kind of interaction, a way of coping with a fragile self-system.
So it's like a defense mechanism.
In a way, yes. And get this, she observed that these figures could actually change over time.
Really? How so?
Well, Peplau described 4 phases of this process. In the first phase, these figures are often pretty helpful. They might offer support, guidance, even represent positive aspects of the person that they've kind of pushed away.
Almost like an imaginary friend, but with deeper meaning.
There can be some similarities, yeah. But as the person's situation gets worse, maybe due to stress or trauma, the figures start to change too.
So what happens in the second phase?
They become more critical. They might start reflecting those negative self-beliefs, those bad me voices.
But like their inner critic takes on a life of its own.
Exactly, and that can be really distressing for the person experiencing it. It can lead to more withdrawal, more isolation.
And then what about the third phase? Does it get even worse?
Unfortunately, yes. This is where the figures often become truly terrifying. They might threaten harm, accuse the person of awful things.
That sounds really scary.
It is, and it's often at this stage that people might seek help or need to be hospitalized. It becomes a real crisis.
Makes sense. It's too much to handle alone. So what about the final phase? What happens then?
The figures are still there, but they're less intense. It's like they've become a permanent part of the person's world, but they've lost some of their power to terrify.
So is it like a kind of acceptance, like learning to live with them?
There can be an element of that, yeah. It's a complex process. But it shows us how crucial it is for nurses to understand each person's unique experience with hallucinations.
We can't just dismiss them. We need to approach these experiences with empathy.
Exactly. So as a nurse, what do you think are some good ways to help a patient who's experiencing hallucinations?
That's a really good question, and a crucial one, too. Well, how can we, as nurses, best support patients who are having these really challenging hallucinations?
I think the first thing is to create a safe environment, a non-judgmental space.
Right, that makes sense.
Because remember, hallucinations feel very real to the person experiencing them.
They do.
So it's really important to acknowledge what they're going through, but without reinforcing the delusion itself.
That sounds tricky. How do you strike that balance?
It is a little bit of a balancing act, but you want to empathize with their distress without validating the actual content of the hallucination. Like you could say something like, I understand you're hearing voices, and that must be frightening, but I want you to know that I don't hear them, but I believe that you're experiencing them.
So you validate their feelings, the fear and anxiety, but not the delusion itself.
Exactly. And you can also try to ground them in reality.
Ground them? How do you do that?
Well, there are some sensory grounding techniques you can use. Encourage them to focus on their breath, maybe the feeling of your feet on the floor, the sounds around them, things like that.
So bringing them back to the present moment, to what's tangible.
Right, and helping them manage their anxiety is really important too. Anxiety often makes hallucinations worse, you know?
Yeah, that makes sense.
So teach them relaxation techniques like deep breathing or muscle relaxation can be really helpful.
Giving them tools to cope.
Exactly. And something else that's super important is involving the patient in their own care. empowering them to make decisions and develop their own coping strategies.
It's about giving them back some control in a situation that can feel very out of control.
It is. It reminds me of what we were talking about before with those power struggles Peplau warned us about.
Right, especially with patients dealing with chronic illness.
She was so adamant that we as nurses really have to be mindful of those dynamics. We don't want to accidentally reinforce the very behaviors we're trying to help them change.
It's all about awareness.
Yes, awareness of ourselves, our own biases, our triggers.
So that we can show up as our best selves for our patients.
Exactly. And it all comes back to that central idea of the therapeutic relationship, the foundation of Peplau's work. And she saw it as a dynamic process, right? One that unfolds over time.
Didn't she talk about different phases of the nurse-patient relationship?
She did. She described an orientation phase where the nurse and patient get to know each other, build trust, and set goals. It's all about laying that foundation.
Like the beginning of a journey.
Yes. Then there's the identification phase. This is where the patient starts to really identify with the nurse, see them as a source of support.
And that allows them to open up more?
Exactly. They feel safe enough to explore their feelings, try new behavior, and then comes the exploitation phase.
That sounds interesting.
It is. This is where the patient really uses the relationship. They might seek information, test boundaries, work through their issues, maybe even push back against the nurse a little.
Sounds like it could be challenging.
It can be, but it's also an important phase for the patient's growth. They're learning to assert themselves, deal with conflict, trust their own instincts, and then finally we have the resolution phase.
So this is where things wrap up.
Yes. The patient starts to detach from the nurse, become more independent, they've taken what they've learned, and they're ready to move forward on their own.
What a beautiful process. It's amazing to be a part of that journey. But I imagine it's not always straightforward. There must be bumps along the way.
Absolutely. It's a journey, not a destination. There will be setbacks, doubts, all of that.
And the nurse's role is to just be that constant, supportive presence.
Yes. Providing guidance and a safe space for the patient to explore their own inner world. Peplau's work has had such a profound impact on nursing. It's amazing how relevant it remains today.
Her emphasis on empathy, truly understanding the patient's perspective, the importance of the relationship, it's also valuable.
Those are timeless principles that will always be at the heart of good nursing, regardless of your specialty. And I think one of the biggest takeaways is that every interaction, every moment is a chance for connection, healing, and growth.
That's beautiful. I feel like I've gained so much from our discussion today.
That's great to hear.
I have a much deeper understanding of Peplau's work and how I can use it to improve my practice.
I'm glad to hear that. Remember, this is just the beginning.
It is. I'm excited to explore more of her work.
Keep that curiosity alive. And always be open to seeing the world from your patient's perspective. Never underestimate the power of a genuine, compassionate connection.
Wonderful advice. Thank you so much for sharing your insights with us today.
My pleasure.
And to all our listeners out there, thank you for joining us for this deep dive into the world of Hildegard Peplau. We hope you found it as insightful and inspiring as we did. Keep learning, keep growing, and keep having those meaningful conversations. Until next time.